Hi everyone, Dr. Erin here. Today I just want to talk about a condition that's come through my clinic doors probably 5 times in the last week, and that is obstructive sleep apnea. And it's a disorder defined by so much more than just snoring really loudly. It's associated with excessive daytime sleepiness, non-restorative sleep, restless sleep, decreased quality of life, increased risk of car accidents, poor work performance, and most notably cardiovascular disease. And there's so many ways that naturopathic medicine can help patients with sleep apnea, but today I just want to touch on 3 really important ones. And the first is weight management. So if you're overweight or obese and you have sleep apnea, you don't need a 21-day detox. You don't need a 7-day juice cleanse. What you need is a well-managed plan that focuses on sustainable and attainable weight loss of approximately half a pound to a pound of weight loss per week. So working with a naturopathic doctor who can outline not only how many calories you need to consume, but also how many grams of carbs, fat, and protein you need to consume. So definitely naturopathic medicine can help with a sustainable, attainable weight loss plan. My second tip is vitamin D3 testing and appropriate supplementation. So naturopathic doctors can write a $30 blood test requisition for vitamin D3. Studies have shown that vitamin D deficiency is really common in sleep apnea, where vitamin D levels are even lower in patients with severe sleep apnea. By running the simple $30 blood test in patients with sleep apnea, naturopathic doctors like myself with prescribing rights can prescribe heroic or high doses of vitamin D3 safely and in the short term in order to get patients into that therapeutic vitamin D3 level. And studies in vitamin D3 supplementation in patients with sleep apnea has shown that vitamin D can decrease inflammation, cholesterol levels, and blood glucose, thereby lowering patients' risk for developing cardiovascular disease. So bottom line, get your vitamin D levels tested and work with a naturopathic doctor who can prescribe appropriate doses of vitamin D to get you to that therapeutic level quickly and safely. And finally, number 3 is acupuncture. A meta-analysis, which is a study of studies, so high-level research, has shown that electroacupuncture and acupuncture are effective and safe treatments for sleep apnea. Acupuncture can improve your apnea index, so that stopping breathing while you're sleeping, and improve oxygen saturation, so you're breathing while you're sleeping, which is a good thing. And acupuncture is totally within the scope of naturopathic medicine, so an ND can perform acupuncture on patients. And there you have it, everyone. That's weight management, vitamin D testing and appropriate supplementation, and acupuncture. All 3 things a naturopathic doctor can help you with, especially if you have sleep apnea. Thank you so much, and we'll check back in later. Bye.